So in July 2021, I was rushed from home to St Thomas's Hospital with COVID. I was having difficulties breathing. Once I got to St Thomas's Hospital via ambulance, I was admitted into A&E. Once I was admitted into A&E, I was then admitted into a ward and then taken to ICU, where I stayed for a little over a week in ICU, and then I was transferred back into the ward, where I stayed for a month at St Thomas's to recover. And while I was there, I had to teach myself, with the help of all the NHS staff, the physiotherapists and the dietitians, how to walk, how to talk, how to breathe again. I feel that the NHS saved my life.
A big step for me was starting rehab. I am 2 months in now and I absolutely love it, and it has been a game changer in my recovery.
I think having first a GP to listen and possibly try to identify what was going on. I had a lot of symptoms which didn't make sense.
Some things that have helped specifically have been really working on my nervous system in different ways. So things like breath work have been really transformational, as well as meditation and just learning kind of how to relax and rest deeply. So that's been really helpful for me in helping to start to get my nervous system to be in a better place again. I benefited from some therapy from the Persistent Physical Symptoms Service at King's, and have really learned how to slowly reintroduce movement into my life, and also learning to take some risks and not be too afraid to start to try different things has also been really important for my recovery. So being able to accept that sometimes it's 2 steps forward and 1 step back, but slowly building that confidence in my baseline and enjoying what I can do within my baseline, and then in another few weeks adding in more activity. That's sort of been what's worked really well for me.
So December 2022, I finished with Nuffield, and in January I followed on with the long COVID clinic, which was extremely, extremely helpful.
There is one lady, her name's Katie, she was an occupational therapist. So during my recovery, long after I'd left hospital, so I'd say about 7 months after I'd left St Thomas's, I was put in touch with Katie, an occupational therapist. And she took her time to listen to me, listen to what I was going through, what I needed, and how to get me to understand the journey that I'd been through.
So going back to the long COVID clinic, that was amazing. I wish it'd gone on a bit longer, if I'm honest, because finally there was a place where I could feel safe and say, this is what's going on. Why?
A massive help has been being part of the patient advisory group for the South East London long COVID programme. It's been a game changer. I have felt more included. I've met some lovely people. I have met long COVID haulers that, you know, actually understand what fatigue is and actually how bearing it is on our life.
For me, it was therapeutic, I would say, in a way, to actually be able to say, I have a disability. I have an illness. As hard as that might be to first recognize, and that's why I say don't be scared to ask for help. Mental health is so important, I think. We can become so closed on our physical pain and all our other symptoms that we forget that also our mental health is taking a hit in between all this.
What hasn't worked is the kind of disconnected help that people have tried to give me, unfortunately, through the NHS. So I've had some really great help. I've had some counselling that was really helpful because I was quite traumatised, I think, by it. And it's my life has changed. I've had some very sympathetic and helpful individual consultants and GP telephone calls, but I've had nothing that has followed through as a thread. And because this is systemic, having those kind of being bounced between different parts of the service is useless to me. And giving me a long list of things on the phone, I can't remember them anymore.
So for me, the early intervention is the thing. So I went to my GP a couple of times, and on the third time, I had COVID a third time and saw him then, but he said I couldn't be referred to the long COVID team for 12 weeks. Had the information that you guys have provided and given that to me 4 weeks in, I really do believe that my condition wouldn't have been so severe and taken so long.
So 18 months / 2 years into my recovery with long COVID, I was then referred by physio to the COVID rehab course, which is a 14-week course. And the first session, when I walked into the group, I didn't see many people who looked like me or sounded like me or from the same sort of cultural background, or just anyone that looked like myself in these spaces. So I didn't feel included in this session, because in my mind I felt that they wouldn't understand my journey. So unfortunately, I felt that the best thing for me to do was to leave that session.
I think that one thing that would be great would be to include my husband has gone through this with me, as well as being a nurse himself and working all the way through the pandemic. He needs some support, he's exhausted. And we need some help together to manage this. So that's one thing, kind of that circle needs to be completed.
I scream from the rooftops, coordination is something very simple, but if you coordinate, I think my main concern was being in all the different hospitals, and I think if the coordination within the hospitals could be a little bit better, that was a real game changer, because I was getting duplicate tests, and my fatigue then in turn but now I have to pace myself, and as long as I'm pacing, I think I get through one day at a time.
I think it's having a clinician who we can occasionally go to, but it's always the same person, because as I move forward, and I am getting a little bit better, I have different needs and different questions, and also everyone's learning a bit more about what's happening with long COVID, and I need someone to have those conversations with, one person, and it needs not to be a horrible struggle to try and talk to that person, and that's what it is at the moment.
So the South East London Long COVID programme is a charity-funded project, and we're funded by NHS Charities Together and Guy's and St Thomas's Charity. We're a 12-month long project. We've just been extended for another 12 months, so we're now a 2-year project, and we're here to help accelerate the recovery of patients living with long COVID in South East London.
Collaborating with patients on this programme has been incredibly powerful, and as a clinician, getting their first-hand experience of what has helped them with their recovery and what hasn't helped them with their recovery has really enabled us to adapt the ideas, the work streams that we've tested out, and really guided us to make sure we are meeting patients' needs that are experiencing this new illness, new disease.